Hello again for another edition of Project Cancer. This is slightly different from the last few because I'm not updating about myself. Here we're talking to Urvashi about her cancer journey. Just before I do that though, because I haven't had an update for a couple of weeks, I just want to say that I will be doing a personal update in the next few days. No major change since the last update. Still struggling with what was happening before I moved on to the second line of treatment and the beginning side effects of the new line. Anyway, this isn't about me. This is about Urvashi. So Urvashi, I met through a friend in Cambridge, because Urvashi spent some time in Cambridge. Let's talk a bit about your background, why, what the connection was with the UK and your return to Delhi, and then we'll talk about your cancer.
Yeah, thank you for having me here, firstly. And yeah, I studied in the UK. That's my connection there. I studied at Birmingham, Cambridge, as you mentioned, and then the London School of Hygiene and Tropical Medicine. And then I came back to India, where I worked mostly in the development sector in public health, and the last 8 years in the policy space, also related to the health policy space. That's really my background, very briefly.
Yeah, that's been useful, hasn't it? Obviously, if useful is the right word when cancer's concerned, you have a better background in terms of your own illness than I had. I've had a steeper learning curve than you. Anyway, let's go back to were you diagnosed in the UK or over there in India? What happened there? What happened that caused you to end up in the health system?
Yeah, I was diagnosed 2 years back in India itself, and I was actually uh, perfectly fine is in terms of how I felt and my physical fitness and energy levels, etc. I didn't have any symptoms either. Suddenly, I just started feeling a lot of fatigue, and that was then followed by a whole range of symptoms, which were actually subsequently what doctors thought were liver related. And so, in terms of nausea and loss of weight and appetite and, things like that. And then I also developed a low grade fever. But really, from the point of onset of my symptoms to the point of diagnosis, it took under 2 months. So it all did happen quite quickly, and certainly from when the symptoms came on, immediately there were different tests that happened, and then there were PET scans, and finally the biopsy. So I think it was relatively quick for at least my type of cancer, which is quite rare. It's ALK positive. And usually, people struggle to get a timely diagnosis even with this. And they are first diagnosed with various other issues. So I think in that context, my diagnosis still happened in a fairly timely manner from the point of onset of symptoms. But unfortunately, I had symptoms when the cancer was already very spread out. So it was already at stage 4.
Yeah, let's just talk about the ALK. This podcast isn't just for people who have non-small cell lung cancer. This is a podcast for people of cancer of all sorts. So can we just unwind? ALK is similar to my cancer, but can you explain what you mean by that and where the primary was and where the secondaries has ended up?
Yeah, so ALK it's a gene which is in all of us, but for some unknown reason and some unknown trigger, it switches on in some people, and that is how they end up developing this cancer. It's a rare form of non-small cell lung cancer, as you said, but interestingly, although it's lung cancer, I hardly had, in fact, I did not have any lung related symptoms really, and all my symptoms were due to spread of the cancer to the liver. So by the time it was diagnosed, it was, it had spread to the liver and the adrenal gland. I think those were the two worst affected, and of course some lymph nodes and some parts of the skeletal system, etc. So it was, and I think this cancer is overwhelmingly diagnosed at stage 4. It is in, often in young people, in non-smokers. For some unknown reason, younger women seem to have a higher predisposition to it. And also women in South Asia, Southeast Asia. So there's some very intriguing characteristics, but we really don't know why, and we don't know what is the reason for this group to be more vulnerable.
Yeah, so the biopsy was on the lung or the liver? Where was the biopsy done?
Yeah, so it was done from a lymph node here, near the collarbone, because that is where they could see a substantial part of the uptake when they did the PET scan of the radioactive, the dye that they inject. And so they could see that there was a substantial uptake in that particular lymph node. So they thought that, it would be best to do it from there.
Yeah, and what was it like there? I mean, this is a crazy question because any of us, particularly at your age rather than my age, because we're up a generation apart, the shock of getting stage 4 cancer just like that. How was life at that point in your mind and your physical health and your family and so on?
Yeah, I mean, I think it's beyond description really for me, the shock. Because as you said, I was just 35, and it was something I had never even heard of, even though I work in public health, I work in the health sector, but ALK is something that I had really never heard of before. So it was shocking at many, many levels. And I think for several weeks and months, I kind of remained in that extreme shock. I think even today, I wake up and there are many moments when I feel, oh my God, is this really happening? But I think then the shock was so extreme that I wouldn't even be able to sit here and talk to you like this. So I think that is what came with the diagnosis, at least in the first few weeks and months.
Yeah. And so obviously you are, there are treatments. It's, as we'll talk about in a minute, it's a rarer disease, therefore less treatment options. There's less money to be made by the pharmaceutical companies, and then there's less research, less people to research on. So what was the immediate thing? What was the immediate start to the treatment?
So I was put onto this oral targeted therapy, this drug which you take every day orally called Alectinib. It's a drug manufactured by Roche. So I was put onto this, and I would say that the cancer symptoms started, receding almost the very next day.
Wow.
But there were certainly side effects that came with it in terms of, mostly cardiac related, sort of slowing of the heart rate and the blood pressure going down extensively. So I think, and of course, some amount of fatigue. So I think those were the symptoms that came with Alectinib. But now currently I'm on another next generation drug because I became resistant, or not I became, the cancer became resistant to Alectinib after about 11 months. So then I had to be switched to another oral targeted drug called Lorlatinib, which is from Pfizer. And this also has a whole host of side effects, right? From the cholesterol going up, the blood sugar going up, some neuropsychiatric effects, then cardiac effects. So there's a lot to manage in terms of just the side effects, even if the cancer is fine and stable and there's no evidence of disease. But I think there's just a lot to manage in terms of side effects.
Mm. So you went onto the drug. Amazing. I mean, you feel that the side effects, sorry, the tumors were shrinking immediately. That hopefully that was psychological. It's very difficult to believe that 1 or 2 or 5 tablets would make that much difference. But it doesn't matter. That would mean that psychologically you were in a better space. How was that monitored? Because the systems might be quite different around the world. Was that scans on a 3 monthly basis or more commonly, or what?
Yeah, yeah. Scans every quarter, and blood tests every month. So, visiting the doctor. Then, of course, because of the cardiac toxicities, also ECGs and echoes for the heart, pretty much again every 2 to 3 months. So there's a lot of monitoring that is happening in my case, because of, obviously you can afford it and access it. There's still a lot of people out there who cannot necessarily afford or access it. But in my case, certainly there's very regular monitoring.
Yeah, and I guess I don't know what the health system's there, but either your employer or you personally are paying something towards this treatment. Yeah, okay.
Yeah, I do have an insurance, but the insurance here, they don't cover a lot of things still related to cancer. And this is part of the problem, that insurance companies still think of cancer treatments in those very traditional chemotherapy, you're getting admitted literally somewhere into a facility, and then you're being injected with this chemotherapy. So now the nature of treatments is changing, and it's already changed in many ways. And so not everybody might be on that kind of conventional therapy. And so in my case, I'm not, I just take these oral medicines. So for the insurance company to even start to recognize that this is also a chemotherapy, it's just that I'm taking it orally, it's a tablet, and to start covering it was a real battle, because they didn't want to kind of accept it even for the longest time.
Absolutely
So
incredible. That's incredible
yeah,
because the lack of side effects, the lack of time required in hospital, the lack of cost of
yeah,
immunization must be a saving, depending, of course, what the tablet costs. So you were
yeah.
fighting this battle at the same time, with this.
Yeah, absolutely. And in fact, till today, one has to keep trying to convince them that everything doesn't have to be inpatient. For everything, you don't have to be admitted necessarily. But yet there is a cost involved, whether it's one of these diagnostic tests or something you do for monitoring or a scan or anything really. So I think that is also a challenge that a lot of the insurance companies need to evolve and also keep pace with the advancements in the treatment.
Exactly. Goodness me. But last time we spoke, you just come back from some travel. So how soon before you felt able or were willing or whatever to go back into the work environment after you were diagnosed?
So I went back to work quite quickly, I think after a month or so. But after I started Alectinib, that is, and the reason why I said that it almost acted instantly because I was having fever every single day for those, 30, 40 days. And then suddenly one day it just went, the very next day after I took Alectinib. So that's why I had this feeling that, okay, it's probably working because that was the first day the fever went away for some after 30, 40 days. So I did start going to work, but like I said, the shock and my mental condition was really not something where I was really there in the moment. I was going through the motions, if I can say, put it that way, without really being there
Mm,
fully because my mind was just not there. So
mm.
I think that I grappled with for several weeks and months, even though I was technically back at work, but I really wasn't functional, in my normal sense.
Yeah, that must have been so difficult. And then when it mutated, did it mutate to something that was common from the original ALK? Is it another version of ALK? What's happened at that point?
So that's remains a mystery, and I think that's the problem with this cancer. Although I had all possible, blood biopsies and everything after the scan showed that a liver lesion had reappeared, and I was having those symptoms fully. I was having terrible, terrible bouts of vomiting and all of that, and of course, my doctor was sort of in denial for a while. He said, maybe this is an infection because alectinib shouldn't fail so quickly. But it did, and ultimately the biopsy showed that the lesion was back.
And this is the
So
same
then we,
biopsy. Sorry, they
sorry,
went into.
no, then this time I had a liver biopsy. This time I had a liver biopsy, but because that's the only place where it had reappeared
Okay.
in the PET scan. So in that particular case, it was we had a whole series of genetic tests, and the samples were sent to the US and various places. But it was there was just no conclusive thing that came out of it, and that is I think the challenge with this. We consulted some of the best experts also in the US and everywhere, and it was nobody had an answer. They just knew that okay, this drug has failed, but why has it failed was not something that anybody can answer till today. So and that's I think part of the fear that works with this disease, because you just don't know when the next drug will fail.
Hmm.
Because if you couldn't find answers to that, you might not have any answers to this either.
So how
So
come the drug you're on was the answer? is it because it's just another generation of the previous one, or does it also address the mutation that you have?
Yeah, so Lorlatinib is what they call a fourth generation, sorry, a third generation TKI. So TKI is a tyrokinase inhibitor, which is these oral targeted drugs
Same
in
time.
simple language.
Yeah.
Yeah, so Lorlatinib is third generation, I understand, and currently a fourth generation TKI is in clinical trials.
Mm.
So the idea is that each generation covers more mutations than the previous generation of drugs. So even though nobody really knows why Alectinib failed for me, is it a new mutation that came up, because they couldn't really find that in the blood biopsies. They just put me onto Lorlatinib because there is no other option. That is really the only other drug which is available for that, and which is third generation. So they just put me, and it was a matter of just doing trial and error and seeing what happens. And thankfully so far till now it has worked. But like I said, each day you don't know when it'll stop working,
Yes,
and
and
nobody knows that.
are
Yeah.
you back at sort of no evidence of disease, if that's the right term?
Yeah, I've been having my quarterly PET scans, and at this point, that's what they still show. But my doctor is also doing, monthly ultrasounds now, because the dosage of lorlatinib had to be reduced for me considerably because of all the side effects and all the toxicities. So I'm on a very low dose actually compared to what is prescribed, and so therefore he's always concerned. And so even in between the PET scans, he does these ultrasounds to monitor that, is the liver fine, kidneys fine, all of that. So, and of course my blood tests and other things are happening as usual.
And are the side effects are you look fine at the moment, but are they fully manageable and having a level of quality of life that you want? Is that fair?
Yeah, yeah. I mean, I think I've found, like we often do in medicine, that to counter the side effects of one drug, then you have other medicines that you take. So I'm taking various other medicines to, counter the effects. So, for instance, statins for, lowering the cholesterol, or some gastrointestinal medications to, just help with those kind of irritations. So, and of course, I'm on an antidepressant for the last 2 years.
Mm.
So that is something that I have been on, and I really require that to function. So I think, yeah, I'm able to function, most of the days, but it's not without a lot of support of, all these medications and everything.
Yeah, yeah. And what you do as much research as me, I suspect. What is the prognosis on the third generation? Is there enough data for them to be able to give an idea of what the statistical average before something else changes is?
So they just came out with a study recently, Pfizer, themselves, they had, funded the study, and, they came out with the results. And uh, I think it was presented at one of those very important conferences, lung cancer conferences that happen. I think one happens in the US, one happens in Europe every year. So the results were very, very good in terms of survival, and a large number of people were, even after 5 years, they were fine on lorlatinib.
Excellent.
So the survival results were certainly very good in terms of just the cancer part of it. But I do think that somewhere the side effect part also needs to be addressed. And obviously, it's a Pfizer sponsored study. So I think there are biases in terms of, you put forward the good results, and you maybe don't highlight some of the not so good results as much. So I do think that that is important as well. But certainly, I think from the cancer point of view, it seems to be a good drug. But like I said, the fourth generation is already in trials, because of how smart this cancer is and how quickly it can just mutate. And so people obviously cannot just rest on the fact that, okay, lorlatinib is working today, because it might not tomorrow.
Yeah. Okay. And yeah, that sounds good news, really. I mean, a 5-year horizon obviously statistically people vary with stage 4 cancer, particularly at your age. All sounds really, really positive, providing, as you say, the side effects are controllable and don't get any worse. And so it feels like the third generation of the TKI is addressing mostly side effects and trying to reduce those more necessarily than mutation. Is that correct?
That's right. That's right. In fact, that is the most exciting part of that drug from whatever we're hearing from the researchers and people who are familiar with how those trials are proceeding. They say that the most exciting part is that, of course, it will cover, maybe certain extra mutations beyond what lorlatinib does, but more than that, we don't see the kind of side effects that we see with lorlatinib with that particular trial drug. So I think if that happens, then it could be a real game changer, because then you're not just giving quantity of life, but you're also giving better quality of life to somebody. So I think that is really the hope with that.
Yeah. Okay. Good. Well, that's about 20 minutes into. We'll just spend the last 5 minutes or so talking about what you've learned from this journey, from what you can feed back to other people who are either starting out on it or somewhere in the middle of it, or a carer for somebody. So, are there any? I wouldn't call them tips, but what do you feel that somebody who's starting on this journey that they should know based on your experience and the way you've gone about your cancer?
So I think one thing is that one should try to be as well informed as possible. And I do a lot of just reading up or just trying to keep up with the latest research. I think it's important to be informed. Of course, you have your doctors, you have your oncologists, but knowledge is power for everyone. And so I think even as a patient or as a caregiver, it's important to just have that level of knowledge, whatever you can. I mean, obviously, you'll never be a qualified specialist like your doctor is, but at least you can read, and there are many things in my case that I end up telling my doctor that, hey, there's a trial happening here, or there's research happening there, because he's too busy with his day to day looking at multitudes of patients here, so he doesn't have time for that. So often it's me doing that. So I think that's helpful. If you can be a proactive person and participant in your own treatment, then that's great. I think the second is mental health is a very neglected aspect often of the whole cancer journey, and I think, or any other chronic disease for that matter. And so I think it's important to reach out for help, to ask for help, and not feel that, you're the only one who's in that situation, because I think most people who are diagnosed will have some mental health challenges as well. So I think that connection is important to acknowledge and also ask for help,
Hmm.
related to that.
Yeah.
And I think finally, I just take it like a day at a time.
Yeah.
I think that's the best you can do, because a lot of it is so unpredictable. You really don't know what's going to happen in the future. So just try to make the most of the day you have, in front of you.
And what about communication with others, loved ones, and further afield? What's your how did you build your support network, and how far have you shared your predicament?
Yeah, I mean, I have my mother, I have my husband. That's really my core support, because unfortunately I lost my father just a few months before I was diagnosed. So, and he was really a huge pillar of support for me. So, and I don't have siblings. So I think I just have really those two people at the core. But I do have friends. I do have, other people I can talk to. But I think I've just realized that in my worst moments, I just have to get through them myself. And so, I've kind of realized I'm my own best friend, and that's how one has to look at these things, because it's very hard for anybody really to be able to help you sometimes when you're in those absolute worst moments, as I've been.
Mm.
And even though I've had my mother or my husband around, but I think even they struggled, because it's not like they also know how to deal with something like this. It was a new, unexpected, unwanted experience for them too. So I think, yeah, ultimately you realize that you have to find that strength, whatever you might call it, courage, resilience, whatever word you might use. But it kind of comes from within, I think, at the end of the day.
And the final question, which is just to do with nutraceuticals, diet and exercise, etc. Have you addressed those in any way?
Yeah, I was always a very active person. I was a dancer. In fact, I was always, and I've tried to continue that once I was able to. It took a few weeks and or months even, I would say, to be able to get back to some kind of walking or exercise. But now I try to do it very regularly, at least my 10,000 steps every day. I try to, make that effort. So that I do. And I think nutrition, yes, I mean, one gets a lot of advice. Sometimes it's very confusing because everybody is offering their own advice in terms of what you should eat and what you shouldn't eat. But just I try to keep it simple and try to have a balance in whatever I'm having. I don't think I can really go on any extreme diets or cut out anything, and I don't want to do that also. But I do try to obviously keep that balance because this drug especially has a tendency to raise, as I said, cholesterol and sugar and everything. So I do have to like control and moderate those things.
Yeah. Good. Well, thank you very much, Urvashi. You've been fascinating. You have a very similar attitude in terms of, obviously, you've worked a lot on it in terms of your mental health and your research and everything. And I wish you well. I mean, it's super tough for all of us who are in this situation. Many of the viewers also will be through this. And I think we've all learned a lot from what you've talked about. So thank you very much indeed. Thank you, Urvashi.
Thank you. Thank you so much.